Today's show was brought to you in part by Prescott Honda.
So you want your teeth to be straight. How do you get them straightened? Of course, the best idea is to go to an orthodontist who has some training, knows how to do that, and can make them beautiful for you. So we're going to talk with Dr. Monika Barakat. She's an orthodontist. Hi, Monika.
Hi, Sandy. How are you?
Good. All right. So you professionally fix people's teeth to make them look gorgeous. I know we have some pictures we're going to be showing of some teeth that are not particularly beautiful, but with the braces and new technology and things, you can make those look really nice. So we want to talk about do-it-yourself orthodontics too, because that's kind of been a trending sort of thing going on. But first of all, in moving teeth, what does it, what's involved in that? How do teeth move? I mean, how can you take teeth that aren't straight and make them straight, Dr. Barakat?
Sandy, so there's a lot of different processes involved in a tooth movement. It's not just shifting teeth into position. In order to achieve a beautiful smile, there is biology, physiology, physics, biophysics, and mechanics involved. So we have to understand the space requirement for those teeth. We need to understand the biology of how the teeth are going to respond, how our body is going to respond to the forces and pressures that we're going to apply. And we need to understand the space requirements to make sure that all the teeth that we do have in our mouths will be able to fit in our mouth. Our body responds beautifully where the bone gets remodeled. There is a complex physiological process that allows us to soften the bone on one side through the pressure that we apply through braces, and at the same time, as the tooth shifts and moves through our jaws, the bone is being remodeled and deposited on the opposite side to maintain teeth in position and give them some stability.
I tell you, that is absolutely fascinating. It is. I wore some braces myself on the bottom one time, and I remember after an adjustment where you tighten that so the teeth are starting to move more. Oh, I tried to eat a hard taco. Bad idea. Sometimes it's a little bit.
We do recommend softer diet after adjustments, absolutely.
Yeah, I found out the hard way. Anyway, a lot of people, because orthodontics can be a little bit pricey at different times, a lot of people are trying to do it themselves. We're kind of in a DIY world, aren't we, Dr. Barakat? So does DIY, does that work? What's going on in that field?
Unfortunately, do-it-yourself orthodontics and dentistry has been around for a while. It's making a comeback with all the advances in technology. We are able to offer our patients less invasive, seemingly easier treatment options. And at the same time, our patients seem to think that it's not so difficult. Why don't we try it ourselves? Unfortunately, some people might be successful treating themselves, but those are very minor movements. However, they record the process and they post it on the internet for others to view. And unfortunately, not everybody's as successful or lucky. Not understanding the processes that are taking place in your body can actually lead to very drastic complications, and people can actually lose their teeth in the process. So I do want to caution anybody that might view a video on the internet and is tempted to try it on their own. Please do seek help of a professional so that they can explain the processes involved, and they can conduct a full examination of your body, of your oral cavity, and make sure that they tailor the treatment specifically for you.
Well, we were looking at some photos while you were talking, Dr. Barakat, of some very frightening things that then the orthodontist has to correct. I mean, there was a tooth that was shooting up into the gum, and also I think an elastic, do-it-yourself elastic on the front teeth that got embedded in the gum. Well, what are some of these complications?
So consumer or patients will try many different things. So starting from teenagers trying to close small gaps between their teeth, they will use small rubber bands that will apply to the side of their teeth. Unfortunately, when those rubber bands can ride up into the gum tissue, and if forgotten and left there, they can cause severe inflammation, bone loss, and eventually a tooth loss. And At that point, unfortunately, as orthodontists, we may not be able to help them. Unfortunately, they will have to seek help of a surgeon and have those teeth replaced with implants, and they're facing a long life maintenance program to make sure that those smiles look beautiful. There are companies who promote clear aligners that will accomplish tooth movement within half the time. However, they do not offer personalized attention or guidance during the treatment. There is a recent report of a college student who utilized a 3D printer in his school to print a model of his dentition, and utilizing a animation software, he actually created aligners similar to what Invisalign does, and used those aligners to correct a relapsed tooth, a tooth that moved out of position after his previous orthodontic treatment. He was successful. However, those were minor movements, and unfortunately that sends a wrong message, because a lot of people will think, well, if he was successful, why can't I try it?
Right. So do you see in your practice, you do see some of these failed attempts at do-it-yourself orthodontics?
Fortunately, I have not in my practice seen any of these complications, but we do hear them more frequently, and it's frightening. And I just wanted to caution any kids, any parents, any teachers, if you do see any signs of attempts of doing it yourself, please talk to the patient and advise them of what can happen. Because unfortunately, like those pictures that I've sent you, there are some drastic examples of what can happen, but unfortunately those are problems that will follow those patients for the rest of their lives.
Oh my goodness, yeah, sometimes shortcuts just don't work well. Dr. Monika Barakat, thanks so much for joining us, and as an orthodontist, she's got the technology and the help to make your teeth beautiful, so definitely go professionally, not DIY on this. It's not a Home Depot thing. Thank you so much, Dr. Barakat.
We sure do.
All right, don't go away.
Thank
When
you
we
for
come
having me.